Joining us for our panel discussion, From Products to Patients, Capturing Value in Asia's High-Growth Markets. My name is Natasha Sunderji. I am the Global Health and Nutrition Lead at Accenture, and I'm pleased to be moderating today's discussion. Over the past 3 days here at JPM, many of you have heard some consistent themes come across from our pharmaceutical leaders, from our healthcare providers, and from investors alike. We've heard about disciplined R&D investment strategies, about pressure on the mature markets, about the need to find durable, long-term sources of growth, and about the role of digital, from AI-enabled discovery to new care delivery pathways and patient engagement models, all about reshaping value across the health ecosystem. What's been striking to me is that much of this conversation has focused on pipelines, portfolios, and near-term revenue outlooks, but there's been a quieter but increasingly important subtext that's been running through all of those discussions. Where does the next phase of healthcare growth come from? And how do companies actually translate innovations into real patient impact at scale? This is what today's conversation is about: tapping into emerging markets, particularly in Asia, as a means to drive growth and patient reach. Asia is no longer an emerging story on the margins of global healthcare. It is now the fastest scaling healthcare investment market globally. Healthcare capital deployed across Asia Pacific has reached record levels in 2025, surpassing previous peaks. Regional healthcare markets are projected to grow from 2.3 trillion in 2023 to more than 4 trillion by 2030, driven by demographics, insurance expansion, and the rapid adoption of digital and generative AI technologies. Now, this growth is not theoretical. Population scale is translating into real, predictable healthcare utilization. Markets like Indonesia with near universal health coverage, and India with large-scale public insurance and national digital health infrastructure. These are converting population growth into demand across providers, across pharmacies, diagnostics, and care platforms. This is creating revenue durability in ways that weren't possible even just a few years ago. Women's health is one of those clear examples of where these dynamics come together. Asia carries a disproportionate burden of women's health conditions, yet remains significantly underpenetrated from a commercial standpoint. We're now seeing femtech and women's-focused care models scale rapidly across reproductive health, maternal health, oncology, chronic conditions, and closing this women's healthcare gap is not just a niche impact story. It represents material, economic, and commercial opportunity that aligns unmet needs with long-term growth. So today's panel is not about impact investing. It is not about philanthropy. It is about commercial returns and what it takes to actually unlock them. It's about moving from products to patients, building the distribution networks, the patient engagement platforms, financial structures, and partnerships that really allow innovations to scale into real-world health systems. And we're so fortunate to have such an incredible panel of leaders with us today to help us unpack this from multiple angles. From a Fortune 500 pharmaceutical perspective, from a development finance perspective, and from digital platforms that are operating on the ground today, reaching patients across Asia and beyond. And together they will bring a view of how these markets are maturing, where value is being created, where risk is real versus perceived, and what investors and healthcare leaders should be paying attention to next. First and foremost, we have Janet Dorling, Senior Vice President, Intercontinental Region of Gilead Patient Solutions. Nafisa Jiwani, Associate Vice President, Health Initiatives at the U.S. International Development Finance Corporation, also known as DFC. Ed Booty, Founder and CEO of Reach 52. And last but not least, Sid Goyal, CEO and co-founder of Nivi, Inc. Welcome, everyone.
Thank you.
Thank you.
Janet, I want to start with you. Gilead has shared such an impressive narrative at JPM this week, from expanding its oncology portfolio to continuing to bend the arc of the HIV epidemic through products like lenacapavir, and presenting one of the strongest, most diverse pipelines in company history. So against that backdrop, how is the company thinking about its investment strategy in Asia, particularly around women? Where are the most compelling short-term and long-term opportunities? And what are those partnership structures that are essential for you to achieve commercial returns?
Yeah, thank you so much. It's wonderful to be here with such an esteemed panel. We agree with you that Asia is one of the fastest growing markets, and we see it as a place to not only create long-term value, but also where there's a responsibility to do better. I like to say in Asia we have a short-term and a long-term perspective, absolutely. So short-term, we're thinking about things like expanding access to care, and absolutely through partners. I mean, working in Asia is a team sport for sure, and we work with different partners in things like setting up an app. We've worked with a partner on something called Love to Test, which links patients to HCV and HIV testing. And through that partnership, we've already had 2 million people access the platform. This is amazing, and this is really about bringing patients into the funnel in a way that works for them. And with the local expertise of our partners, we're able to do that in a way that's most effective. Longer term, we're looking at healthcare system strengthening and really setting up a sustainable future. We have a wonderful partnership that incorporates academia through working with Harvard, as well as the government in Vietnam and other partners, where we're looking at bringing care to where actually patients are, so out of big cities into communities. And this is looking again at treating HCV and HBV, which is a big opportunity in Vietnam and elsewhere in Asia. And what we've been able to do is really show that you can not only make an investment in a healthcare system, but create value for the long term as well, which is wonderful. From a women perspective, I'm going to go a little bit adjacent to Asia because we're so excited about the work that we've been doing in sub-Saharan Africa. But women, I mean, one of the biggest unmet needs in healthcare, full stop. It just is. And at Gilead, we come to work every day thinking about that and how we can do better. If you want to impact global health, you really have to think globally. And so we have been very proud, and you mentioned lenacapavir, thank you, to do something that we think is really innovative and revolutionary, which is to bring lenacapavir through partners like the US government, as well as other global nonprofits like the Global Fund, to sub-Saharan Africa, where women account for over 60% of new infections, adolescent girls and young women. And to bring this new intervention to the communities where they need it most in the same year as it was launched in a country like the US, I think is the new standard that we should be holding ourselves to. And our commitment to do work like this is going to continue, but we're really proud of this. And we again think this is a way that you can do the right thing, but also create value. It's a global community, it's a global brand, so you really manage both and are able to hit on both aspects in the market. So I'm really happy to be talking about those two things, and we're going to continue this work.
So we're going to pick up on a couple of the threads that you just talked about. One was using digital platforms to connect patients and increase that funnel size, as well as the health system strengthening elements when we talk to some of our digital innovators. But I want to go to Nafisa because you just mentioned some of the US government partnerships. Nafisa, you come from DFC. Many folks in the audience might not know who DFC is. Let's start with who is DFC? What do you do? What are the kind of instruments you use to have impact?
Sure, so let me give you a little bit of background. DFC is the US government's development bank. We have several different financial tools to invest in emerging markets. And so maybe let me just give you a little bit of background. One, you might have heard of DFC in the news lately because we just went through reauthorization, which is very exciting for us. Our limit used to be $60 billion as an institution to invest, and now we have over $200 billion for us to be able to invest. So we're quite excited about that increased limit. Our bread and butter as an institution in terms of financial tools has really been debt financing and political risk insurance. There are very few institutions around the world that have the ability to provide political risk insurance, and so it really is an opportunity for investors to look at opportunities in emerging markets that they otherwise wouldn't be able to without that tool. So aside from debt financing and political risk insurance, we have the ability to do equity investments. Again, with reauthorization, we have a lovely increase in terms of how much we can invest. And so now from 30% minority ownership, we have 40% minority ownership as well. into those types of investments. We also have investment funds that we are proudly investing in, and so we can talk a little bit about those types of investments in Asia, which have been quite powerful, I think, especially when we think about smaller investments. I think are critically important in the global health space. But those are the types of investment tools that we have at the DFC. There are other DFIs, development finance institutions around the world, that are government-backed, but this is a government-backed institution in the U.S. We do work with other DFIs. I say that because sometimes the investments where you're looking at manufacturing and you're taking on a larger risk, we want to work with other DFIs, and we do that often, sometimes with the World Bank Group IFC, sometimes with the European Investment Bank, sometimes with the Asian Development Bank as well. And so depending on the type of investment that we are making, we'll work with other banks as well. Does that help in terms of just giving background, Natasha?
Perfect. Let's pick up on one of those partnerships.
Sure.
Asia Development Bank. I imagine that where you two are going to market together is largely around compelling healthcare investment opportunities in Asia. What are some of the most compelling investment opportunities that you're seeing across Asia Pacific?
It's a great question, and I think hopefully Ed will be excited about this as well. But I think that what we've seen in terms of opportunities, and before I get into the things we've seen in terms of trends, I'll tell you the types of things that we can invest in first, if that's okay.
Perfect.
The three areas for DFC in terms of what we can invest in the health sector space, the first is around health services and infrastructure. So anything that is delivering care that is brick and mortar, we can invest in. So think hospitals, clinics, specialty centers. That's something that we can invest in anytime, any day. Manufacturing and supply chain, if you're looking at vaccine manufacturing, diagnostics, therapeutics, we can invest in those things. We're very excited about lenacapavir. Maybe there's a world in which we're working with Gilead to work with the CMO, with the tech transfer, and maybe we are providing liquidity to that CMO so that they can, in fact, produce lenacapavir at scale. Those are the types of things that we can do in that manufacturing and supply chain space. And the third is this really interesting space with the intersection of health and technology, where I think we've got some interesting innovations on this panel as well. But really looking at asset-light type of projects, and that's where sometimes equity becomes really interesting in terms of a tool. So those are the three buckets where we can invest in. What we're seeing in Asia that I think is quite interesting is this idea of pharma supply chain and where there's opportunities for pool procurement. And so we think that's critically important. We've seen that happen through the pandemic where pool procurement was critically important, definitely in sub-Saharan Africa, but I think we're seeing opportunities in Asia as well. And so I don't want to steal Ed's thunder, but I'd love to sort of hear from Ed in terms of the types of things that you're doing too. But I think pool procurement in that space is critically important.
All right, Ed, she set you up for success. Let's build on this idea of pooled procurement, some of the work that Reach 52 is doing there, and the unique gap that it's filling and why that's an investable opportunity. And then we can expand to talking about some of the other great areas that you're doing work in that are crowding in interesting investments.
Yeah, sure. So, first, thanks for everyone for joining us today. I'm Ed, set up an organization called Reach 52, taking our name from the fact that over 52% of the world can't access essential healthcare. Many of those people are in Asia and Africa. I'm based in Singapore. We started in Southeast Asia. Now a lot of our business is India, and more recently we've started working in about 6-7 African markets as well. Two main parts to the business. One is we manage sales, marketing, and distribution of medicines. We also do regulatory work, so to register products in a market. We currently distribute for Pfizer, Sanofi, Novartis, and Bayer. We're also starting to look at diagnostics, and we do a little bit in generics as well, generics on our own brand. But structurally, just so you know how that works, we do a lot in NCDs. Women's health is a big focus area of ours. We've just licensed Cyanopress, which is Pfizer's self-injectable contraception. We're distributing that in various African markets. India will be next year. Range of NCDs, women's health, maternal health, pharma, diagnostics, and generics. To the pool procurement part, what we're trying to do is, if you imagine you're Sanofi, there's smaller markets, there's often in Africa, these are relatively small businesses. We will do the sales and marketing and distribution, but we try and aggregate those small markets into single purchase orders. So instead of having to serve 10 small markets, we're going to Sanofi with one larger aggregate order across 10 markets. That means they have to ship us one big order, easier. we can get better pricing, and we obviously pass that on to the countries and ultimately to the patients. Second main part of what we do, and then I'll sort of wrap, selling medicines is essential. Many products are more expensive in Africa and even India, Southeast Asia than US, America, Singapore. You wouldn't believe how expensive some products are. Parallel import, they'll be bringing it in from the UK to Kenya, so you're paying UK prices plus. But even if you solve the medicine affordability, there's structurally quite low demand in emerging markets. So another big part of what we do is train health workers and do screening. This is great impact, but it also pulls through products, builds markets, and really means that we're sort of investing in the health system that subsequently would pull through the products that are better prices from that first bit. So yeah, sales, marketing, distribution, procurement, aggregation, plus training doctors, training health workers, and a lot in India that we can come on to later.
So let's build on this, Ed, because a lot of the conversation we're trying to have today is about what are the commercially viable, investable opportunities in healthcare. Talk us through your journey. You've been at this for a while. How did that education process look? How did the financials evolve over time? Are there learnings that you can share in today's discussion?
Yes, I think there's money to be made in emerging markets, full stop. You just can't use the same business model. Going in with a full pharma affiliate organization, general manager, sales, marketing, distribution, regulatory, quality, compliance, big heavyweight pharma organization, landing in a smaller market, economics often doesn't stack up. So we're absolutely of the opinion that there is a market, but the market is structurally a bit smaller, just by default, economics and macro and micro and everything. And therefore, you have to look at new commercial models. So you can't make the markets bigger. You just have to look at how you access it through an asset-light or a resource-light or a partnership-led sort of model. But then in terms of the opportunities, I'm super passionate about NCDs. Big lack of government funding, huge demand, huge unmet need, makes business sense, but also makes huge amounts of social impact. Women's health, not just saying it because of this panel, huge area that we're focusing on. Everything, not us, but you see big opportunities in everything from fertility and IVF right through to, we're even looking at some more innovative tampon products. It's a US innovation, VC-backed, a tampon that's an HPV self-test kit. So instead of doing a smear, it's actually a tampon, you wear it, US innovation. We're starting to distribute that in Africa. So yeah, it's a whole range of diagnostics, pharma, and all normal commercial categories, for me, are exciting in emerging markets. You just have to look at it in a more asset-light way to make it sustainable. You can't go it alone, is how I'd say.
So let's pick up on this theme of asset-light and this idea that the same business models don't work when we start to think about emerging markets. And Sid, I want to come over to you. Nivi has done some incredible work with direct-to-consumer models across the Asian markets where the traditional healthcare infrastructure is still developing and looks fundamentally different. What makes these markets ripe for leapfrog innovation? And give us some insights from the kind of data you're collecting through the direct-to-consumer model you're having and how that's allowed you to establish really interesting pharmaceutical partnerships where they're using your data to improve access and affordability and drive commercial returns.
Yeah, thanks, Natasha. Great to be here. But I think Ed talks about it really nicely, is how do you reach that patient? In the West, you have the PCPs, you have the insurers, so you have referral pathways. Over in these markets, those don't really exist. Most spending is out of pocket. 35 to 40% of healthcare spending is out of pocket. And so what we've taken is this really different view on things, which is really that front door to the health system lives in everybody's pocket. It's on these messaging platforms. And so we engage consumers on behalf of our partners like MSD, on healthcare conversations using the most popular messaging platforms out there, like WhatsApp. So it's two-way conversations. This speaks to that asset-light approach to consumer engagement. You don't work through health systems that are still being built, right? You don't work through the HCPs, you don't work through insurers. You go direct to the consumer, you talk with them, you have those two-way conversations, and as you said, Natasha, it's not just about engagement, it's not just about awareness, but it's about insights. And so you get insights that the pharma companies can use to really tailor their access strategies and affordability strategies. For instance, we worked with MSD's market access team. This was in Africa, but to help them design an insurance product that they could use to cover HPV vaccination. So that was one critical insight, was that affordability is a key concern. Certainly side effects are a key concern about things like vaccines. And so what we're doing essentially is tailoring conversations to each individual's needs, and then aggregating all of those insights to help our pharma partners grow their market share. Because, you know, really they've only touched on the surface, and what we're trying to do is create something that can scale through an asset-light model.
So Janet, I'm going to come to you. Sid just said that we've only touched the surface of the demand as pharmaceutical companies. Do you agree? Why is that? What's that barrier that's preventing us from actually reaching patients at scale?
Well, I think part of it is, I mean, we've mentioned infrastructure still building. In many of these countries, you know, there's one healthcare provider and one payer, and you know, there's still evolution happening. And I think I'm going to honestly say it's just part of it is the partnership. What I've found as I've been working with, you know, different governments throughout Asia is there's a strong desire to partner, and I think we have to do things differently, but come to the table, and it's never just the two of us. It's usually involving other critical stakeholders, and so I think, you know, through more collaboration and partnership, and I think shared aspirations about what is it that we're trying to accomplish. I mean, I haven't met a government that wants things like hepatitis C in their population. Like, everybody wants to do the right thing. They want to work to eliminate, but I think we just need to work even harder together, and everyone on this panel has a part in that, but many who aren't here as well. And if we do that, I think we can get a lot closer.
So let's pick up on these partnerships. Many of us are intimately familiar with the need for partnerships as we try to expand access, but let's get more concrete. And this is going to be a little bit of a lightning round. I'm going to go across you. What is the biggest barrier to getting these partnerships to actually work? I'm going to start at that end.
I think biggest barrier is aligning the incentives, or, you know, unpacking the incentives. You know, everybody has, you know, the right North Star is how do we serve that patient better? But each person's incentives have to align. And I think that's, you know, it's not, you know, insurmountable, but it's more about just having the right conversations at the right time, you know, to make that work.
All right, incentives. Ed, you can't use that one. What's yours?
You know, firstly, I would agree with them. Very loud. Firstly, no, yeah, I would agree with incentives is a big problem. I think the other thing that we see a lot is just time. Like health moves slow in general in the US and UK, where I'm from, right? And then add emerging markets onto that. And often, you know, a lot of partners just don't have the patience, you know.
Yeah.
Sometimes we're asked to do a 6-month project, and I just laugh because it'll be like, it will take us a year to register your product, and then it will take time to sell that product, and we have to start talking like 3 years and up.
Great.
And especially many corporates, understandably, don't have that patience, you know, and there's a dip in share price, and there's a change, and there's some cuts or something. All this kind of stuff has happened to us. We've been mid-project, and just there's not enough time to build the demand and volume. So, yeah, incentives need to be aligned, but then also patience to make it happen, because it does take, it's harder in emerging markets a lot of the time.
Great one. Nafisa.
I would say that depending on the type of investment, like if you're looking at, you know, large infrastructure projects, it's going to be government will. That's critically important. We're not going to be able to move fast. I don't care how much the project is. I can't move if there isn't government will. So whether it's a hospital or a manufacturing project, that to me has been critically important in terms of partnership. And then I think if it's, you know, working with the private sector, it really is understanding the market that you're trying to get into. And so is the regulatory environment ripe for what you're wanting to achieve is critically important as well.
Oh, yeah.
Janet.
It's the worst to go last. I set this all up by saying partnership. No, I'm kidding. I've found, and this is maybe a thread that can pull through all of the answers, it's really a desire to seek to understand. Because again, there's no one in government that I've met that says, well, I don't want to make things better for my population. Everyone wants to do the right thing. But what that means to them and what that means to you, and truly understanding not just what you want to achieve, but how you want to achieve it is critical. And there are cultural differences, there are sometimes social differences, there are economic impacts. I mean, we've just gone through COVID, which took a lot of resources out of government pockets, right? And so I think just having that more nuanced conversation, that takes time, that takes aligning on incentives, that takes government will. But when you do that, I really think so much is possible. And I've just been so heartened to see it over and over again, working in different places around the world. So it's I'm a real optimist on this, but we need to have those conversations and really understand.
So I'm going to open it up to audience Q&A in just a minute. So please feel free to line up behind the two microphones here. But before we do that, I'm going to ask a question around how do these organizations that are sitting in the audience here better work with your companies, with your organization? I'm going to start with you, Nafisa.
Sure. So I love this because the U.S. government is not the easiest to navigate, 100%. But the people that are in this room have the benefit of coming to me, and I will make the commitment that if you come to me and you want to understand how DFC can either support you or not support you, depending on what you're looking for, I am happy to do that. And so I have my business cards and I will do that for you. But I will also help you understand how to leverage our other partners as well within the U.S. government, whether that's the U.S. Trade and Development Agency, whether it's State Department, which is doing quite a bit of work right now around global health, whether it's Exim Bank, which again can be quite helpful in this space, our Commerce Department, like any one of those entities, I'm happy to engage, but it's an offer that I only make when I'm speaking, and to this group, because it's not too crazy, I'm happy to do that. But it is complicated to come to the U.S. government and figure out how is it that I come forward. The other thing I will say, only because I get this question quite often, is how long does it take if I'm going to go ahead and move forward with an application and work with the U.S. government? It depends. And so I always like to say that we will move as fast as you move. And if you are experienced with getting capital, then you will move much more quickly through our systems because you'll understand what diligence looks like. You'll understand what it is to know your customer. And so that KYC process is not going to be new to you. If it's new to you, then it will take longer. And so it'll be anywhere from 6 months to 18 months, depending on where you are.
Nafisa, I'm going to stay with you.
Okay.
Given you've given this incredible offer to the folks sitting in the audience, what is the biggest learning you've had in engaging with folks when they come to you? What guidance do you have to them to make sure that that first conversation with you is as valuable as possible?
I do not finance ideas at all. You need to have a business plan. It needs to be where you are running an institution. So like, working with Ed would be something that I would look at because it is a clear project. And so if he's looking for debt financing and he has a clear idea of what sources and uses it look like, that would be something that I would entertain. If you are, I have an idea, I'm a physician, and I'm really interested because I used to live in Indonesia and I want to set up a hospital, that's great. You're not looking for DFI money. You might be looking for grant money. And that's fine, but that's just not what I do. And so that would be the one sort of piece of advice I would give to you is figure out what type of capital are you looking for.
Perfect. Ed, what advice do you have to folks who want to partner with you? And then what advice do you have to folks who have similar digital solutions in Asia Pacific and want to get to the kind of impact and scale that you've achieved?
Yes, and for the first question, yeah, we want products to distribute. Yeah, if you want to access emerging markets, we're trying to be a very simple, we'll help you register it. If it's not, do sales, marketing, distribution, buy in bulk. We need decent credit often. That's kind of the ask. We can't pay cash in large orders. but we will help you open emerging markets. We have started working with some smaller US innovators, as mentioned, so single product companies. We're also really keen to help them open markets. So yeah, go through our website. But how that works, just so you know, once we do have a product, we try and help with volume forecasting. We'll do a bit of research, speak to some distributors, and if we think it's got legs, we can start talking commercials, In terms of, scaling, a lot of our work is tech. We haven't really touched on tech, but the whole supply chain, we got, 3 warehouses and stuff. All that's tech. And then we do the health worker education and training and screening, and we've got tech for that as well to track the outcomes. Biggest mistake we made by far is just scaling too quick in general. We went to too many countries too fast, and then everything is hard. Like changing the team's mindset. We're going to do something new, and then you have to change the team mindset. We're going to change a feature, you have to roll it out. Our app's used by like 16,000 health workers, and just change is just harder. Like everything's slowed, and we scaled before we had the app right, is by far the biggest mistake. And
Okay,
that cost
so
us money.
unpack that for us with a little bit more detail. How many countries did you initially scale to? Kind of, if you could go back in history, kind of what would you achieve in one country before you move on?
Just, I guess, everything that to some extent that I've talked about, the whole stack of sales, marketing, distribution, plus the app, just the whole model. We sort of built it a bit like this, as we've grown. Just get the end-to-end flow working properly in one big market, including all tech, data and dashboards, all that has to be in place. So wouldn't
So
be
the whole
about revenue
system
metrics or
solution is
anything.
what really
it'd be the system
unlocked
solution,
thing. Okay.
Yeah.
Sid.
I'm going to take a slightly different tact. Actually, we started in Kenya, and then we moved a year and a half later into India, and then a year later during COVID into Nigeria, and now Thailand and Indonesia. For us, actually moving into multiple markets was helpful because we were able to see, we're different because we're asset light. It's all software. So it's easier to scale across countries, but we're able to see what works in different countries and take the best of all worlds to build the offering that we have right now. As far as working with us, I think the easiest thing, and we've done this with MSD, is what's a core question that you have? Is there a question about a particular patient or consumer population that you need answered? And if you start there, and if you know I need this question answered, then we can start, because we like to move fast. We could draw out like 5-year plans, but that really doesn't work in these markets because they move so fast. It's really about, let's start with that first question and then build from there. And that's how, we build relationships, and that's how we build the offerings that we do. As far as advice or what would I do differently? I think we would want to, in one of the markets, at least more deliberately tie into the health system from the early get-go. Because I think that's, again, we talk about awareness, activation, and then closing the loop. We do provide referrals into the health system, but, we're not tied into an appointment scheduling system. One, they don't really exist in a lot of places. But I think it's, if we could develop a use case around integrating into a health system, that would be something that we might do earlier if I had to change anything.
Makes sense. No one size fits all is the theme I'm getting from the two of you. In some cases, when you have a solution that only truly works by unlocking multiple parts of the system and making it work, it might make sense to kind of hone in on one geography, really get it right before you scale. Whereas when you have an asset-light solution, there might be economies of scale to be achieved, but always being very conscious of how it integrates into a bigger system solution, how it integrates into a broader health question, so that you have the right kind of partners coming to the table. I'm coming to you last again. I'm so sorry.
It's okay. No pressure. I like the challenge. I would say probably some recurring themes. First of all, be very clear what your ask is. There's sometimes very undefined asks of general partnership, and because we have a lot of different ways that we partner with organizations, having an understanding of what you actually want is critical. A clear story about alignment to Gilead's priorities, and a very clear story about patient impact, because at the end of the day, that's what we're all about. And then I think, if you can have that clarity of purpose, then it's easy to have a conversation and say, actually, that's a fit, that's not a fit, or, if it's not me, I know who to get you to. And that would be my answer.
Looking to the audience, are there any questions from folks sitting in the room? I have a long list, so I'm happy to hog the mic if needed. Please. Oh, don't mind jumping to the mic so people can hear you. And feel free to state your name, introduce the organization you represent, and then ask your question.
So Nicholas from Scientific recently got a drug approved that's thinking about international extension. Beyond Europe and beyond the US. So what are the key priority markets in Southeast Asia? And maybe I'm talking to you, Janet, that you would think about the top 5 besides China.
Yeah, I think it sort of depends on what it is and what you're doing. So I'd be happy to talk to you more offline. But I would just start with a very clear understanding of disease burden and then capabilities. And, one of the things I'm very cognizant, having worked in small biotech, mid-size and large, is when you're a big company, you have a responsibility and the privilege of being able to do a lot of things that aren't always revenue generation, but investments in the future. So I'd also say, what's your capacity and appetite for long-term versus short-term investment and returns? And I would say it would start there. But there is a lot of growth and opportunity to make an impact, and then it's just the way that you can afford to do that and over what time frame.
Let me open that question up to others here. I think I 100% agree with the points that Janet made, that it depends on the product, and one has to look at the disease burden and such. But Asia is such a complicated market to navigate. What are the top 3 countries in your list that get you excited? And why is it? Is it the patient? Is it the population size? Is it the fact that there is a strong leader in government? Building on a conversation we had outside right before this. I'm going to go to you, Nafisa, because it just set you up.
You're going to come to me. So I am quite interested in Indonesia, but that's really because I've been incredibly impressed with the Minister of Health, who has a banking background. I think the innovative ways in which he is dealing with decreased budgets has been quite interesting and compelling. I know that our agency is really interested in investing more in the Indo-Pacific, and so we're right now at $6.1 billion in terms of investments. We hope to increase that by 2 or 3-fold. And so for us, whether it's making investments in health or making investments in infrastructure, we hope to do more in Indonesia and in the Philippines.
Ed?
Yeah, I'd agree. Yeah, disease burden, government priorities. Does it align with government priorities and also regulatory landscape, I'd say. Indonesia is an exciting market, but there is some tax negatives. They're promoting domestic manufacturing, so if you're an international manufacturer, there's additional taxes often. So there's a bit of market access issue. I think after that, just find a good partnership. There are commercialization partners in Southeast Asia that do multiple markets, e.g. Gilead Pharma, they're big, good distributor plus sales marketing. Wellester, happy to have to give a list, but yeah.
So Ed, what's the other country you'd put on his radar?
I'm from an impact social business point of view, I'm bullish on India. Huge gaps, huge growing economy. Now world's third, fourth, fifth largest economy. Many big pharma companies are going back, having exited. Very mature market. So it's big, it's growing, and you've actually got a lot of very good partners in there. So yeah, we're pretty bullish on India. And I'd agree Indonesia's exciting, but it's more of a B2G model, I'd say, in general.
Sid?
Yeah, Indonesia is definitely exciting for us. I think there's the public sector, private sector, the complementary pieces, the financing of care, that's important. We're demand side, but a lot of times one of the insights we see is, well, I can't afford this thing. How am I going to pay for this thing? And so, financing becomes important. So for that reason, Indonesia's interesting. India is, because of its sheer population size, is very interesting. It's just messy and complex. But if you can go and and the regulatory environment's also messy and complex. But again, we're digital, so for us, we have a little bit of a bias, so we can just launch there very quickly. And then the other markets that are interesting are Vietnam and Philippines.
Why?
They have strong health systems. And so you have some structural foundations there that are, that you can build on. But the products either haven't really penetrated those markets, or they're just landing on those markets. And so there's opportunity in those two markets as well.
I saw another question over here. Oh. We'll do the two questions together. How about that? And then we'll open it up to the panel to respond. So.
Just to add on this, I'm based in Singapore and I do mainly in Southeast Asia. So in terms of markets, yes, definitely Indonesia, Philippines, Thailand, Vietnam, also Malaysia. You have roughly a market of 500 million people there with good out-of-pocket affordability. So you can, depending on the country, you're more or less effective in terms of registration. Malaysia would be smaller but faster to register. So, but you really have to look at it at each market being very different. You don't have an ASEAN framework there. Sorry.
So we have about 2 more minutes left, so we have to do this one a little quick.
My name is Tisha Jepson. I'm CEO of True Bearing Diagnostics. We have an infection diagnostics RNA-based. Doctors at this point, before CT scan, before exploratory surgery, don't have the ability to determine is there an infection present or not at any kind of accuracy, especially outside of regions that have big hospitals. We can see bacterial, viral, biofilm infection. We can also measure the magnitude, so we can really enable regions to be addressed. My question is, we're fairly small now. How do we proactively think about moving out and preparing ourselves to be that when we are that big company and we do want to make that positive impact, or to start moving into the market now, or to think about it and to position ourselves so that we can, and so that we can be helping the broader population? What would be your kind of advice, and should I just take it offline?
Maybe we take that one offline, because I have a feeling that that's going to be a much longer conversation that's going to really depend on the level of maturity of your solution. But as I'm going to perhaps broaden Nafisa's kind offer to the audience, if you have opportunities that you'd like to pitch to the great panelists that are here, please don't feel shy about doing that. Being conscious of time, maybe I will take this moment to ask one final question. Rapid, 10 seconds each. What is the most promising long-term opportunity you see in Asia? I'm going to start with you because I feel like I've been done a disservice.
Thank you. No, honestly, I will just go from my personal experience. I think it's, partnerships. We have just had incredible success thinking about what we can do now later in partnership with governments and others to really evolve the system so that, again, what we want is sustainable growth. And we want people to have not only the financial capabilities, but the healthcare infrastructure. And so, from my perspective, which is very different than others, and I think it's that. I think it's thinking about the midterm now.
And sorry, maybe I should be more specific, but I'm going to say the long-term investable opportunities in healthcare. But it could be through partnerships.
Yeah. I honestly don't think that. I guess it takes the investment of having employees to have those strategic partnerships, but that's where I see the biggest change and the biggest payoff for investments.
Manufacturing and supply chain, hands down.
I'd agree. Obviously, more of a supply chain play, so I'm excited about what we're doing. But I'd also add, I think diagnostics is really underdeveloped, to your point. You have, medicines is sort of starting to solve. You have a lot of generics, and therefore access to medicine is going up. But I do think the whole diagnostic infrastructure is massively underdeveloped. And as countries get richer, you'll start seeing more money going into diagnostics and screening. And that's lacking now. And as countries get richer, it should be an investable opportunity, I'd imagine.
Wonderful.
And I think for us, direct to consumer, right?
Yeah.
You don't have the restrictions or legacy systems that exist in the U.S. or whatnot. You can build from the ground up.
You can leapfrog much quicker.
Yeah, you can go.
All right, I'm going to do my best to wrap up in 30 seconds. Apologies, I probably can't do justice to the brilliant points that have been made across this panel, but my one key takeaway is probably that the next phase of healthcare growth is not going to be driven by products alone. It's going to be driven by the systems that connect those products to the patients, whether it's direct to consumer chain that actually gets those products to the patients. It all comes back to the patients in the end. The distribution, the patient engagement, the financing, the trust, they're no longer adjacent to growth. They are the growth strategy. So for the pharmaceutical leaders that are in the audience, growth is going to depend on how effectively you partner to reach those patients. For the healthcare providers in the audience, think creatively around some of the digital and community-based models that are the means through which you can scale responsibly. And for the investors in the audience, the opportunity isn't just investing in the brilliant individual companies that are represented here and others that may be in the room, but also in helping them to build that infrastructure that turns those demographic shifts that we talked about at the beginning of our session into durable demand. Huge thank you to our panelists for their candor, for their leadership, and for engaging in today's conversation. I hope all of you are leaving with a clearer understanding and clear sense of the value of where health growth is coming in Asia, and with the confidence that you can capture some of that value in these markets, because it's not only possible, it's well underway. Thank you so much, everyone.
Thank you.
Thank you.